Well, worrying about your biological clock is no longer an issue just for women in their 30s and 40s. Now women as young as 21 are panicking about being infertile.
Should these young women be concerned, or is this just a trend in our I want it now culture? Cheryl Calvin has more. That's a good point. It
really does sound like something that would be more of our I want it now culture. Yeah. But, you know, some of them, we actually spoke with a specialist, and they say that some of these women just do need a little bit of patience, but some of them really do require treatment. Take a look.
Fertility specialists are used to treating women mostly in their 30s and 40s, but now many 20-somethings are knocking on their door. Dr. Oleg Bess is an OB/GYN in Beverly Hills, and he specializes in treating women with reproductive problems.
There's a lot of younger women that come in and expect to get pregnant right away. And of course, they will have tried for 2 months, for 3 months, 4 months, and already they're in the office asking for help.
A recent government study reveals nearly 1 in 4 college-educated women in their 20s received fertility treatment. That rate has doubled in 7 years, even though doctors say infertility is a low risk among these women.
Women should start worrying about infertility after they've been attempting to get pregnant for about a year.
But Dr. Bess says that some women, no matter how young they are, suffer from conditions that make pregnancy difficult.
That's why we listen to everyone. That's why we do the testing. We have to really make sure that they're not major problems.
Good girl, and we enjoy having you at school.
Roshane Posel was 27 years old when she sought medical help for infertility.
I've been having a problem since I was young, like I say, 24. So from there on, I already know that I have to be consulted with the doctor.
Her problems included fibroids, endometriosis, and cysts. These conditions affect the uterus and ovaries, making it difficult to conceive or carry a baby full term. Symptoms include pain, irregular menstrual periods, and heavy bleeding. In women, however, problems appear later in life and don't come with any symptoms at all.
160 beats per minute.
Brenda Brown had her first child at 21 with no problems, but when she remarried and got pregnant in her 30s, she miscarried as a result of fibroids.
My sister had them, but for some reason I was like oblivious to the fact that I would get them.
Dr. Bess treated both women using a minimally invasive procedure called laparoscopy.
Laparoscopy allows you to do all types of surgeries through very small incisions. The video has been advanced. We can see much better. The instruments have been advanced. After the procedure, the patients are able to go home the same day.
While patients like Roshane and Brenda needed help getting pregnant, Dr. Bess says that young women shouldn't panic.
I think we see infertility in the news much more nowadays. The younger women now exposed to that information do not stress over it, because most of the women will get pregnant.
And Dr. Bess also says that infertility rates significantly go up when a woman turns, this is the magic number, he says 37. And he also says that African-American women are more likely to develop fibrosis. And for any more information that you might need on Dr. Bess and his clinic, just go to our website at KTLA.com, and there's the information on your screen as well. Shocking, huh? To think that at 27 that you have to go for fertility treatments, but that is the case for some of them as well.
But it makes sense if somebody has been having problems since a young girl, or if there's that tendency in the family, along the family lines, you know, you might expect there might be some bumps in the road.
Yeah, well, 37, again, that's when that is the number.
When it starts changing. It's not over.
Changing.
Not over 37, girls.
But that's when it starts changing.
All right, Cher, thanks.